Let us discuss about the modifications of spinal pia mater. What are the coverings of the spinal cord? There are three coverings. One is the outer dura mater, middle arachnoid mater, and inner pia mater. In the case of dura mater, there are two layers in the case of covering the cerebrum, that is endosteal layer, which is outer one, and meningeal layer is the inner one. Whereas in the case of spinal cord, you will see only one layer of dura mater, then the arachnoid, and then the pia mater. So what is this pia mater? If you see the, you are seeing the specimen. So this is the cerebrum and these are the two cerebellar hemispheres you are seeing from the posterior aspect, and this is the spinal cord you are seeing. So what is spinal pia mater? It is the vascular inner covering for the spinal cord, and which closely invests it and completely invests the spinal cord. And if you see this section or specimen, this is the specimen of spinal cord from the ventral aspect or anterior aspect, where you can see this cuttedge is the membrane, this membrane, cuttedge of the membrane, that is the pia mater you are seeing. And in the midline you will find anterior median fissure. In relation with that, there is a thickening of the spinal pia mater, which is known as the linea splendens. So in the midline, it is in the anterior median fissure, it is seen as a thickening called the linea splendens. And if you see here, these are the ventral roots and dorsal roots which are attached to the spinal cord, and they are going towards the intervertebral foramina, where they will unite and form the mixed spinal nerve. So the spinal pia mater extension will be seen up to the intervertebral foramina along the spinal nerve roots, where it becomes continuous with the perineurium. So in the midline, it is the anterior median fissure with linea splendens you are seeing. Then if you see laterally, in between the ventral and dorsal roots, you are seeing tent-like extensions of the pia mater, which are indicated by these arrows, and these are known as the ligamenta denticulata. So the ligamenta denticulata are modifications of pia mater and are about 21 pairs are seen. Then if you see in this specimen, you can see the spinal cord, and the termination of spinal cord here, it is called the conus medullaris, and from the conus medullaris there is a white glistening extension is seen, and that is known as the phylum terminale. It is the phylum terminale. This is the phylum terminale. So in this slide you are seeing the linea splendens, ligamenta denticulata, and phylum terminale, three of the modifications of the pia mater. Now see the cut section of the spinal cord, where you can identify the inner grey matter, which is butterfly shaped, and peripheral white matter in the cut section of spinal cord, which is closely invested by the pia mater, and you can see the subarachnoid space, the arachnoid, and the outermost dura mater you can see with the dorsal and ventral roots and the mixed spinal nerve, and you are seeing the thickenings of the pia mater in relation with the anterior median fissure, which is known as the linea splendens, and in relation with the posterior median septum, there is the subarachnoid septum is there, another modification of pia mater. And laterally you are seeing the paired ligamenta denticulata passing between the ventral and dorsal roots, and in relation with the linea splendens in the anterior median fissure, it also contains the anterior spinal artery. If you see in this sagittal section, you can also identify the spinal cord and the conus medullaris, from which you are seeing the extension of around 20 centimeters extension. This is the phylum terminale, and it receives the coverings of the other two coverings of the spinal cord, that is the arachnoid and then the dura mater. And first 15 centimeters is within the dural sac, and last 5 centimeters it will come out of the dural sac at the level of S2 vertebra, and it will be going towards the coccyx where it gets attached. So a part of phylum terminale is within the dural sac, which is known as the phylum terminale internum, and the last 5 centimeters which is outside it is known as the phylum terminale externum. So now you know what are all the 4 modifications of the pia mater. So what are they? Linea splendens, subarachnoid septum, ligamentum denticulatum and phylum terminale. So if an MCQ is asked, you should be in a position to answer it. So for example, the linea splendens is a modification of endosteal layer of cerebral dura mater, meningeal layer of spinal dura mater, spinal arachnoid mater, spinal pia mater. So the right answer is the spinal pia mater.